So GAE stands for Genicular Artery Embolization, and the genicular arteries are the small arteries that go out to the knee. Okay, there's typically 4 genicular arteries, sometimes 5, but they go out to the knee that help supply the lining of the knee joint. And what we found is that in patients that have arthritis, osteoarthritis, a lot of the pain is actually caused by inflammation in the knee. And that inflammation, and there's increased pressure in the knee joint, the synovium, which is the gland that makes the knee joint fluid, gets inflamed and enlarged. And that's where a lot of the pain is, when patients can point and touch and say it hurts right here. And so when patients have had steroid injections, that's what it tries to do, is decrease that inflammation. The problem is those only last for a little while. So what we can do is we can actually put a small catheter in through the groin or sometimes in through the ankle, put the catheter right out into these small genicular branches, and we can find those areas of inflammation where that gland is inflamed and enlarged. And we put that small catheter there, and we inject just a very tiny amount of these little microscopic particles. And they're typically made out of collagen, but what they do is they go out and they decrease the blood supply going to that gland, and that area that's inflamed, then once you decrease the blood supply, it begins to shrink down, and so the patient's pain and discomfort goes away.